And I'll hand over to you. If there's anything that you'd like to add that I might have missed in your introduction, also know that you are an international best-selling author and a leading voice for women's hormone and health. And I think we're all excited to hear what you have to say tonight. This webinar will be fully recorded, guys, and it will be made available on Active Academy's website. Dr. Daniela Steyn, over to you.
Anneliese, thank you so much for your very warm welcome, and thank you for organizing this event. As you said, I'm Dr. Daniela Steyn. I'm a South African trained doctor, and I'm so proud to be here today and very proud of each one of you who are in this very full room. It's lovely to speak to such a full room of people. I would like to congratulate you. Doing extra studies is tricky. It is tricky at all phases of life, but it is even harder if you have a full-time job, if you have a family maybe to care for. Some of us have aging parents. It is a big deal to be pursuing further studies, but it's going to be so rewarding. I want to congratulate each one of you who are here. It's incredible. I personally have continued to pursue further studies, and it's been hard. So I know exactly what all of you are going through. I know it is like to be a full-time working mom, to have raised a small family, to study at night. And I trust that each one of you will get something from this talk tonight that you can take home and implement right away to take your life to the next level, to take your education, your studies, your quality of life to the next level. So I'm going to dive right in. I'm Dr. Daniela Steyn. I studied at the University of Pretoria, medicine, but then I continued my studies. I did further studies in Canada, at the Graduate Institute in Geneva, at McGill University, also at Harvard Medical School. And currently I'm very passionate in helping people to live their most optimal life. You know, in the phase that all of you are now, quite often you put everything into your family, your work, you pursue extra studies, that's why you are here. And then sometimes, just out of the blue, something else can hit, as if you don't have enough on your plate. And we call that perimenopause, the whole phase of life that you go through for about the 10 years before menopause, during menopause, and after menopause. And it can be devastating to so many people. Just as soon as you think you figured life out, then suddenly you can be hit as if you're hit with a brick of walls, where you might be forgetting words, you might not be sleeping well. And it is so important to really understand what is happening in this phase of life to optimize your health, optimize yourself, so that you can thrive through your studies, thrive in your career, thrive at home. You can. So I'm going to share my screen here. And my hope really is for each one of you. I'm going to answer questions after, but my hope is for each one of you to take something home right away. And even if you're not a woman in midlife, what I'm teaching you today is what I teach my medical students at McMaster University, the residents who rotate through me and with me at our hospital, the doctors and coaches that I teach at my lifestyle medicine clinic, and then also what I teach doctors at our hospital on how to prevent burnout and how to thrive through life. These are the exact same principles that help women thrive through menopause, and the exact same principles I'll be discussing with you today. So let's dive right in. I'm going to share my screen here. There we go. And I'm going to minimize my own video. There we go. So, as I said, I'm double board certified in lifestyle medicine. Lifestyle medicine looks at everything we can do outside of medication to take our health and our quality of life to the next level. Sometimes it can feel to us that everything is too much. And sometimes everything is too much. But sometimes it might feel to you that you might not be coping with this phase of life, and I know all of you have been there, where you feel that life, work, family, and then maybe even your hormones and everything at once is just too much to cope with. And I very clearly remember my mom went through menopause when I was in high school. And at that time, she did further education, postgraduate education, specifically in women's health and in women's rights. And looking back, a very, very big reason why I am so successful today is because my mom mirrored to me that when she went through this hard time of life, having to deal with a full-time job, 4 kids, fluctuating hormones, hot flushes, not sleeping well, she still pushed through and she pursued further education. So just remember, whatever you're going through now, there's someone watching, someone who you are a role model to, that you can be a mentor to. So even though it feels like you're not coping, continue, let your light shine very, very brightly, but learn something today that you can implement to help you to cope. First of all, I would like to encourage each one of you to have your physical health checked out. If you have not had a checkup this year, make sure you book at your local clinic with your local healthcare provider, local doctor, a walk-in clinic, and ask them to do blood work, to do your hemoglobin, to check your iron levels, to check for your thyroid, to check for diabetes. If you wake up early in the morning, or if you don't sleep well, if you wake up feeling unrestored, you might have sleep apnea. Make sure that you get a physical health checkup. That is really key. I think if you take one thing home from our talk today, and you make sure that you are healthy, that is so critical. I know we're in a phase of life that we don't necessarily focus on our physical health because there are so many things to do, but it might be something that's very easily fixable. If you, this picture here shows that you cannot pour from an empty cup. And I think that is quite critical. If you're running on empty, you cannot be a good student. You cannot be a good parent. You cannot be a good spouse, a good partner, a good parent, a good caregiver if you're running on empty. So make sure you fill your own cup first. You know how they say on the airplane, if the airplane goes down, to put your own oxygen mask on first. That's what I would really want to encourage you today. And if you feel your oxygen mask is on, you're good, then you can take this analogy further and to sharpen your saw. You know the story of the wood choppers? And 2 guys were chopping wood every day from the morning early till sunrise, till sunset every day. But then the one wood chopper noticed that the other guy takes off over lunch for an hour. He just disappears into the woods and he comes back, and at the end of the day, they've chopped the same amount of wood. And he was like, what is going on here? We start every morning at the same time. We end every day the same time. You take an hour off over lunch, but still you're able to chop more wood every day than me. Why? What is happening? And then the other wood chopper says, oh, it is because over lunchtime, I go and I sharpen my saw. So, or my axe if you're chopping. And that's what I really want to encourage you today, to take stock of your own life and to see where you're running on empty and how you can fill your cup. What are the things that you can do to sharpen your saw so that when you are chopping wood or when you are studying, that you can study more optimally? And we'll go through these steps one by one. What are the things that you can do to optimize your health, optimize your quality of life? And but first of all, make sure that your hemoglobin is good, especially for women in midlife. If you have a heavy monthly cycle, you are losing blood every month. If you are anemic, there's no way that you can compete with the version of you that have optimal hemoglobin levels. You need red blood cells to carry oxygen to your brain, to function properly, to have good energy. If your hemoglobin is normal, which is good, the next thing to check out is your iron levels. Sometimes your doctor might just run a basic panel, say your hemoglobin is good, you're good. But then, if you take it a step further, might notice that your iron levels are low. And this is quite significant. I see it specifically in my clinic where I deal with women where we optimize health. They might first go to their family doctor, their first checkup might be normal, but they'll come to me saying, you know what, there is something is off. There's something. And then when we delve a little bit deeper, their ferritin, their iron might be low. And once we supplement that, then that makes a significant difference to their concentration, memory, mood, energy levels. Next thing is your thyroid. Check for diabetes. That is so critical. And then we'll go through that further, why it is so important. But yes, first have your physical health checked out. Next one is lifestyle medicine. I'm double board certified through the American Board of Lifestyle Medicine. I am so passionate about lifestyle medicine. These are the basic building blocks. If you look at the 6 pillars of health that we will be discussing today, you can significantly optimize your quality of life. You can prevent cancer. Only about 10% of cancer is because of bad lucks and getting it genetically. 90% factors can be changed through your lifestyle. Diabetes can be prevented through lifestyle. And we'll chat next on what is lifestyle. But then even if you do everything perfect, what happens in midlife is that you might be hit with what we call perimenopause. So most of you know menopause would be, or maybe you won't know, that is actually, even though South Africa is really on the forefront of menopause education, South Africa is the first country to have had a menopause clinic. Dr. Wolf Utter started the International Menopause Society. He's a South African doctor who started the South Africa Menopause Clinic. He also started the International Menopause Society, North American Menopause Society. Our first female doctor did her PhD in endometriosis. So South Africa is on the forefront, but you personally might not have learned about that. So we learn in school quite a lot about puberty when you hit your fertile years. Menopause is when a woman's natural cycle ends, and that signals the end of her fertile years. That does not signal the end of life. You still have half of your life in front of you. Say the average woman go through menopause at 51 years of age. She might live till she's 80 or 104. So that really signifies midlife. It is an incredible time for a woman in her life, a time where you can take your career to the next level, where you can really shift your focus a little bit from childbearing to your career, to yourself, to all this wisdom that you gain in the first half of your life, to now be in a leadership position and give this wisdom over to the next generation. So it's an incredible time in a woman's life. However, it is a time where it is quite important to be talking about these changes, because these changes might significantly disrupt your life. So we know that menopause is quite often signified in your body by hot flashes. This is something that people talk about quite a bit in the end of your period. But then there are other things. In the perimenopausal years, the 10 years before you go through menopause until the 10 years after you go through menopause, where you can have significant hormone fluctuations. We have many hormones in our body, mostly estrogen and progesterone, where it can cause significant disruption of sleep. It can cause disruptions in your intimate life. It can cause more mood symptoms. And where women often say that they don't feel like themselves again, And partners, male partners, come to me at that time saying that they don't understand their female partner anymore. So I'm so grateful for all the men joining us today, because this is quite something significant to understand when a partner, a sister, a mother is going through this phase of life, that it's important to talk about that, to not be shy, but to give women space to be able to talk about that, to say that I notice changes in my body, and it's not just in my reproduction. Menopause is not just about your monthly cycle. It's much bigger. It affects your hormones, your brain. On my newsletter and also my LinkedIn newsletter, I talk quite significantly the change in cardiovascular health after menopause. Women are at a significantly higher risk of cardiovascular disease when their estrogen drop. It's a beautiful phase in your life where if you address things properly, because you're now at risk of developing type 2 diabetes, obesity, metabolic syndrome, but there's also a beautiful window of opportunity that if you address these changes and you go to a doctor and you get help and you screen for cardiovascular risk factors, you can significantly increase your longevity, the duration of life, by addressing things now, screening for diabetes now, cholesterol now. It's quite important. So with perimenopause, though, it's important to understand that these changes that you might experience might cause symptoms that you did not anticipate. So you might know about the hot flashes and brain fog, but you might suddenly have a decrease in confidence or some anxiety, or you might be doing a big presentation in the boardroom and suddenly forget what the next slide is about or forget your words. This often causes significant distress in women. This is at a phase in our career where we should really step up, go for that next promotion, ask for a promotion, go to that next level in our career. But going through perimenopause can significantly take away a lot of your confidence. And a lot of women then actually either quit their jobs, which is devastating, or don't put their hand up for that promotion, that C-suite level job, that supervisor job, that next level in their career. And that is something that I am truly, truly passionate about. And I hope that you hear this if you're in this phase of life, or remember this if you will only get to this later, to know that if you do get to this phase of life and you suddenly lose all confidence in yourself, in your body, in your mental functions, to know that it's temporary, it's not going to be there. And there are things that we can do to improve our concentration, our focus, and decrease brain fog. And I'll be going through these things with you now, one by one. The first one that we look at is nutrition. So very interestingly, when we go through menopause, women and perimenopause, suddenly their metabolism would shift significantly. So a lot of people will notice weight gain, and then they would actually start cutting back on calories to try to keep their weight in check. But this is the worst thing you can do, because if you're not adequately eating, you're not nourishing your body. If you're not nourishing your body, your blood sugar might drop. If our blood sugar drop in our brain, the first thing to go is your mood. You'll become more irritable and your memory will be impaired. So quite critical is to look at your nutrition. And frankly, for all the students, even if you are not a woman going through midlife, but for each and every student, it's absolutely critical to look at your nutrition. When you eat something unhealthy, like a donut, a chocolate, a pie, your blood sugar goes up, your body secretes insulin, and your blood sugar comes down crashing. So you might think you've eaten something, but because whatever you've eaten got converted into sugar into your body, and you had significant insulin release, that sugar drops again and your blood sugar goes low. So the way we prevent that is by making sure we eat protein with every meal. And you want to eat in a way that your ancestors ate years ago. Any food that gets made in a factory, we call processed food. This actually includes bread, pasta, pizza, any fast foods, anything that comes out of a box. The ideal way that you want to eat is the way that food is when you see it on a farm. To eat eggs, protein, like chicken or fish, even tuna, though it comes out of a can. That is quite often for myself, who work in a busy hospital, who have to carry my food with me. A can of tuna is often a very, very easy way to eat almonds, any whole food. We call it a whole food diet that has proper protein, not processed. You can have a bag of almond nuts with you. Then with the protein, you always want to eat fruit and veggies. So you want to eat an apple, or rather than a snack or a chocolate, you want to eat carry with you nuts and an apple. Healthy fats is quite critical for your brain. That would be things like nuts, walnuts, cashews. And to really focus on whole foods, and I can guarantee that if that's the one thing you start implementing today, to make sure that you take a good hard look at your diet. Chips and fries, processed foods, all of that increases your risk of cancer, increases your risk of type 2 diabetes. All types of cancers are driven by obesity. So that is a significant difference that you can do to reduce your risk of chronic disease, reduce your risk of diabetes, cancer, heart attack, stroke, by cleaning up your diet. And for most foods that are healthier, veggies, protein, you don't necessarily get that feel-good dopamine release that you get from eating fries in your brain. But after about 3 weeks, your taste buds start to adjust. And as you regulate your blood sugar, you'll see how your focus improves, your memory improves. It makes a significant difference to your quality of life. It doesn't have to be expensive. There are budget options, but looking at nuts, tuna, eggs, yogurt, cottage cheese, to just add some protein with a veggie, that can make a significant difference. Next one to look at is physical activity. So I know this can be very, very hard if you're working full-time and studying at night and sitting for hours in front of your computer. The first thing I often recommend is to start walking more. If you walk to work, try to get up at one taxi stop earlier and walk a little bit further. Try to really increase your steps. Try to walk after every meal. If you walk after a meal, it helps for the sugar from your meal. So even if you don't eat sugar, even if you eat a sweet potato and chicken, that food gets converted in your body into sugar. But then if you go for a walk after your meal, then that sugar gets put into your muscles. If you just go and sit in front of the couch, watch on the couch in front of the TV, that gets converted into your body, stored into fat. So any sugar coming from your food that you don't eat turns into fat. So that is a significant difference you can make, to just go for a walk. First thing in the morning, before your first coffee, go for a walk. Then if you want to up that, if you say, okay, I'm already getting a lot of steps in every day, I want to up my exercise, the next thing you can do is to increase your muscle mass. That makes a significant difference in optimizing your focus. For people with more muscle mass and less fat percentage, has shown to do significantly better with memory testing, with decreased risk of chronic disease. You can significantly optimize your health. You can optimize your metabolism by just having more muscle mass. If we have two twins standing next to each other, and the one has a higher muscle mass in their body, and even though they look the same on the outside, the other one has a lower muscle mass, the person with higher muscle mass will have a faster metabolism, lower risk of osteoporosis, lower risk of chronic disease, will be able to eat double the amount of the person with very low muscle mass. So the biggest thing you can do to your future self is to increase your muscle mass. You don't have to go to a gym. You can do things at home. You can look on YouTube videos, like I have things on my website as well. Exercises that you can do at home to increase your muscle mass. Next thing you can do is to improve your quality of sleep. So this is something that I regret not knowing earlier in life. But if you can optimize your sleep, try to aim for 7 to 8 hours of good sleep, you will significantly decrease your risk of chronic disease, significantly improve your focus. So even if you don't have only an hour or 2 hours to study a day, if you study those 2 hours with very sharp focus, you'll be able to retain more information. Sleep is absolutely critical. I didn't know this when I was a medical student, and especially if you have to get up early in the morning for work and you have little kids at home, it can be very hard to prioritize sleep. One way that you can optimize your sleep is to make sure that you don't have any caffeine after about noon, because caffeine will prevent you from going into your deep restorative sleep. The next thing you can do is to make sure that your blood sugar doesn't drop. If you get woken 3 o'clock in the morning, it can be because of low blood sugar. Make sure that you eat protein before you go to bed to keep your blood sugar stable for longer. And then the other thing is to avoid alcohol. You might feel that alcohol helps you unwind at night, but it prevents you from going into deep restorative sleep cycles. So when I was a medical student, our guideline was actually that you're not allowed to have more than 1 to 2 drinks a day. In Canada, we now changed it to 1 to 2 drinks a week because they found that alcohol is the biggest driver of cancer. Then, so sleep, really prioritize sleep. And the other hack would be to not look at a screen for 2 hours. I know 2 hours is a long time, but for 2 hours before bedtime, to not look at your cell phone, not sit in front of the TV. And especially if you're studying, that's actually perfect time to study. Try to study on paper. I know we're also online. If you study online, try to set your screen settings to dim it, to improve your, so these bright lights don't make your body think that it's day. Because if you're watching bright screens like your cell phone, your body thinks it's day. And then it's also hard to go into your deep sleep. The next, which is very, very big, is stress management. So there's different ways to manage stress. All of us are exposed to stress when something bad happens to us. It stresses our body out. Sometimes even the way we eating unhealthy can stress out your body more. Not walking enough stresses out your body more. And unfortunately, all of us are exposed to a lot of stress. However, many of us worsen our stress by watching the news and by the TV shows that we watch, by doom scrolling on our phones. That is usually the easiest way for people to cut back on their stress. When you are seeing something stressful on the screen, your body can't distinguish whether this stressor is something happening to you or if it is something that happened on the news. The easiest thing to cut back on your stress is to reduce your screen time, to unfriend people who post stressful things on their social feed, and to be a very, very, very good steward of what you allow into your mind. There is this story about the guy who had 2 wolves that would fight against each other every weekend. And then people would bet on it. Bet which wolf is gonna win. But the owner always knew which wolf would win. And one of the the gamblers asked him, how do you know how do you always know which wolf is going to win? And then the owner said, it is the wolf that I feed. And that is exactly the same in our lives. If we feed negativity, if we watch stressful shows, we will have more anxiety. We will be more stressed. If we feed our positivity, if we surround ourselves with amazing positive people, we make sure the shows we watch, the news we consume, that if we feed ourselves with positivity, we will be less stressed, less depressed. That's just a fact, shown in research over and over again. So make sure you feed your good wolf. And so closely ties into that your social connections. Research has shown that you become like the 5 people around you that you spend most time with. If you're surrounded by friends that are not good friends, doing drugs, drinking too much, not sleeping well, not furthering their careers, if you're surrounded by people you don't want to be like, then it's a good time to take a good hard look at your relationships and specifically invest in people you want to be like. It is also being part of a community has significant psychological benefits. So I really encourage you, if you're not part of a community, connect with a small group here at IQ Academy, people you study with. I highly recommend that you invest in the people around you and in your community. A big thing that we learned in lifestyle medicine is that you can literally give yourself cancer by drinking alcohol. So to really avoid things that are breaking your body down, and I personally would like to add to this also unhealthy relationships. If you are in a relationship that is abusive, either physically, emotionally, financially, get out. It is get help and get out. There's no sense in you trying to fill your cup, but there's a big hole in your cup that you're constantly draining from. So to free yourself from unhealthy relationships is the best gift you can give yourself. That brings us to the end of my talk. I am grateful for everyone who invested their time to listen to my talk today. I've helped so many people optimize their quality of life. I know there are things that you can take home from today. And to recap, we looked at the 6 pillars of health according to the American Board of Lifestyle Medicine. First of all, check out your physical health. If you are developing type 2 diabetes and you pick it up early and you start treatment when you're still a borderline diabetic, you can avoid diabetes with lifestyle by eating healthy. If you take a hard look at your life and you realize that you are not active, you have a sedentary life, you sit most of your day, start walking, start doing steps. Especially for women, start doing strength training. Increase in muscle mass reduces your risk of osteoporosis. It can significantly improve your quality of life, having more movement. They've done big studies where they looked at generalized anxiety disorder, major depression, where they would have 2 groups of people doing physical exercise every day and people on antidepressants or anti-anxiety medication. And in all these studies, the people doing physical exercise have much better scores than the people on antidepressants. That being said, I put people on antidepressants all the time. If we admit someone to hospital because they're so depressed, too depressed to get out of bed, they're not going to go for a run, right? So it is critical to, if you're concerned about your mental health, go and see your doctor, go and see a psychologist, work through therapy, work through trauma. That is absolutely, absolutely critical. But then to take your health to the next level, really, really consider physical exercise to optimize your mental health, to manage anxiety, to manage stress, to sleep better. You will notice on days that you've had a good half an hour run, you will go into your deeper sleep, have better quality of sleep. So that's big. The next pillar was avoid unhealthy relationships, make sure who your social connections are, improve your nutrition, and then be very cognizant of what you feed your mind with, and to be more kind to yourself. There is something that we teach called self-empathy, where research have shown that you might have had it bad the first 15 years of your life, growing up with critical mom, not having a good life. But then for the next 15 years of your life, where you are now, you are that person who are maybe not nourishing your bodies good, not making sure you get enough sleep, being critical to yourself. So be very cognizant of the running commentary that's in your mind. You know, is this critical? Are you speaking to yourself the way you would speak to a loved one, to a friend? And if it's not, then change your inner dialogue. That can make it made a significant difference to my quality of life. I used to think that I must just be a little bit harder on myself. I must be nice to everyone around me, but I must be firm and hard on myself. But research shows us that once you are more empathetic and compassionate to yourself, you are able to be a better spouse, a better partner, a better mom, a better dad. So I really, really, really encourage you to become aware of that inner dialogue. And if you ever notice that it's negative, criticizing, to stop that and to replace it with something positive. Thank you so much for your time today. I've put here on the screen some of the resources. I host the Wellness MD podcast. It was on the number 5 most listened to healthy living podcasts. So I really, really recommend, and you can search through the topics if there's something like how to optimize your sleep, how to lose weight, how to manage migraines naturally, whatever it is that you're struggling with, really have a look at our podcast. I have a YouTube channel where we have so many resources, everything that we offer in our clinic. We want to give people to have access to for free. So look at, you can have a look at my book, you can have a look on YouTube, my podcast. We have a newsletter that you can subscribe to for tips to your inbox, how to elevate your level, your health to the next level. I have a Substack. Every one of you are on Substack that you can subscribe to. I have a LinkedIn newsletter you can subscribe to. I'm everywhere on social. And go ahead, get connected, and let me know what I can do to support you to take your health to the next level.
Thank you very, very much, Dr. Daniela Steyn, for those few tips that you've given us. I think, feeding the good wolf is quite important. And I think we don't always realize sleep is important. When we're younger, we always say, oh, I will sleep later when I'm older.
Yes, we say that.
We do. So I think we'll sleep, we'll always get that sleep later. And I've asked the students, guys, and any participants, just if there's any questions, just pop it in the chat. Dr. Daniela Steyn will get back to you on those questions. For those of you who've got your hands raised, if you don't mind just popping those questions in the chat for us, so Dr. Daniela Steyn can get to that. But I think, for me, it is quite interesting to see how Canada is a first world country, slightly a bit ahead of South Africa, but I mean, we're not too far behind as well. Our health is quite important, getting those exercises. And I think what one student said, if you're home alone and you're by yourself, what you do then, social committees go out, meet people, I think is quite vital. So Dr. Daniela, I don't know if you want to try, you've got about 10 minutes left.
I'm having a look at the chat here. So I'm just going to start random. If I'm answering your question, it's not that it's more important than someone else's question. I'm just starting here and then I'm going to scroll through. The one is, at what age can you anticipate to go through menopause? The average age worldwide is 51. If you go through menopause before 45, make sure that you go and see your doctor. We call it premature ovarian insufficiency. So every person is different, right? But then if your ovaries, so our ovaries secrete estrogen, progesterone, and testosterone. So even women has testosterone in their bodies. Testosterone you continue to secrete when you go through menopause, but your estrogen and progesterone decrease. That natural estrogen protects you against heart disease, protects against stroke, protects against osteoporosis. If you've gone through menopause before 45, it's quite critical to go and see a doctor, because research shows us that you have to go on estrogen to protect you against dementia, heart disease, osteoporosis. If you go through menopause, and menopause, we say that you've not had a menstrual period for more than 12 months, because at the end of your cycle, it might become irregular again, it might become more heavy. That's why I say to go and test your hemoglobin, make sure you're not anemic. It might become more heavy. But then if you have not had a monthly cycle for more than 12 months and you're under 45, your doctor will recommend for you to go onto estrogen to protect your bone density, heart health. If you go through menopause after 45, then it's your option whether you want to go on hormone therapy or not. We know that there's the least amount of risk if you go onto hormones within 10 years of menopause and under the age of 60. So if you go online, you will see, oh, hormones are so good because it prevents dementia, it prevents stroke, it has all these benefits. But we get maximum benefit if we kind of keep your body young where it is at. And if you just continue kind of where you are at. Hormones are not anti-aging. So if you age, you've gone through menopause, no treatment for 10 years, and we put you then on hormones, it won't turn back the clock, but it can kind of freeze the clock if you go onto it in a timely fashion. So if you are interested in hormones, go and see your doctor. I have more resources on my YouTube channel specifically regarding that. Next one, more info on diabetes. Yes, very interesting. Some people get diabetes when they're younger, where their pancreas doesn't secrete enough insulin. We would call that type 1 diabetes. But then in midlife, we can get type 2 diabetes. If you know that you have type 2 diabetes, your doctor will test your blood sugar and will also test your HbA1c, which gives us an idea of how your sugar was controlled over the past 3 months. So it's not just a test in time, it also shows us how much damage has been done to your red blood cells, because every time your blood sugar goes up, it does damage to your red blood cells. We can measure the amount of damage. That tells us, do you have pre-diabetes, type 2 diabetes? If you have that and you go on a very strict diet, no sugar, no white flour, you eat only protein and vegetables and fruit, and you literally eat the way people ate 100 years ago, whole foods, then you can reverse your diabetes. You can prevent diabetes by eating healthy, and you can reverse your diabetes by eating healthy, and diabetes can significantly impact your quality of life. So that is very reassuring to know this is something that you can do. Fasting for 2 days out of 7. Okay, so that is a big thing. I don't recommend that you fast 2 days out of 7. I hope you're referring to intermittent fasting. So intermittent fasting is where you do not eat for a period of time. So we all fast when we sleep. So say you sleep for 8 hours, you don't eat for those 8 hours. And then you would maybe eat first thing in the morning again. Some people do very well with intermittent fasting, where they maybe make that window a little bit longer. So for 16 hours, they don't eat. All the food they consume within that shorter window of time. It's very helpful for weight loss. However, it's not helpful for your body if in that shorter period of time when you eat unhealthy foods. So it's very critical to look at your protein, your fruit, your veggies, and make sure you eat whole foods, not some fad diet not something weird, but to eat eggs, chicken, fish, lots of beans and vegetables and fruit when you do eat. That is very, very important. You want to nourish your body. So some people that have zero stress levels do wonderful on intermittent fasting. But I found that the majority of people that I work with, that CEO at a big company, like all of you guys here, studying extra, already working full-time and studying online, not eating might be an extra stressor to your body. That might increase your cortisol levels, and with that increase in cortisol, you will just keep fat around the abdomen. It can impair your quality of sleep. So every person is so different. I have patients who I tell, stop eating continuously, have a bit of a period where your body can break down fat. But then the majority of people that are students, I would think that in your case, it is better to nourish your body and not to have an extra stressor on your body. So the same way that alcohol stress your body, not eating for too long periods of time can stress your body. Then
I think a very last question to that, Dr. Steyn, maybe, if you don't mind, but it all depends on you. We've got 4 minutes left. Can you maybe provide more information on symptoms of premenopause or menopause, please? Maybe age categories or stages?
yes.
A little bit higher up in this one.
So for everyone, menopause can present differently. 10-15% of people are very lucky. They just notice their period stop, then they've gone through menopause, they're done. The majority of people will have mood symptoms where you will not feel like yourself. You might have heart palpitations. You might have decreased energy. You might have hot flashes. You know, there's more than 100 symptoms that you might be experiencing. And many of these overlap with other things. That's why it's so important to see your doctor, not to say, oh, it's just my hormones, when there's maybe something physically that we could have critical to see your doctor. But symptoms that I see most often would be decreased concentration, decreased energy, difficulty sleeping, and feeling irritable and anxious. Thank you so much to everyone. I have resources on our website. I have more YouTube talks. And please go and advocate for yourself. Get help, get support. You are worth it. Thank you so much, Annalise, and thanks for everyone.
Thank you very much, Dr. Steyn. We've also posted your website on there as well as your LinkedIn profile. So if anyone wants to reach out to Dr. Daniela, go have a look at her website, which is not the podcast that she's spoken about. All that additional information is also available in the chat. Dr. Steyn, thank you very, very much for tonight and this very insightful information that you shared with us. We at IQ Academy and all of our students quite thoroughly enjoyed it, and we really appreciate you sharing that little nugget with us. So thank you so much, and we'll make sure that the video is uploaded on IQ Academy's website. Have a lovely evening, guys. Thank you very much, Dr. Steyn, and thank you so much for your time.
So welcome. Take care.
Thank you. Bye.